Hello, my name is Dr. Shariq. I am a neuropsychiatrist and I am practicing in Jaipur, Rajasthan. In this video, we are going to be talking about a very common condition called as migraine. In my practice, I see a lot of patients who come to me with headaches, and they often ask me, Doctor, is it a migraine or is it some other kind of headache? So in the next few minutes, I hope I will be able to provide you a good understanding of what a migraine is and what international diagnostic criteria that would use it to differentiate from other kind of headaches. So let's talk about the first point that I look into when a patient of a headache comes to me. So basically, migraine is a neuropsychiatric disorder in which the patient keeps getting recurrent episodes of headaches again and again for months and years to come. And for a headache to be called a migraine, there should be at least 5 episodes in the past. But if there is less than 5 episodes of headaches in the past, then probably there is some other secondary cause that's causing the headaches, which we need to look into and investigate further. So the other important criteria that we need to ask to the patient is how long would an untreated episode of headache last? So the migraine headache episode lasts from somewhere around 4 hours to 72 hours according to the criteria, and this is a very important diagnostic point from differentiating it from other types of headache like tension headache or cluster headaches or sinus headaches. So once this frequency and duration criteria are fulfilled, we can then move on into the clinical and signature characteristics of migraine. So one of the most important clinical feature of a migraine headache is that involves one side of the head, or it is unilateral. Although in some cases that I have seen, migraine headache may also be bilateral, meaning it involves both the sides of head. The second important point is the nature or the quality of the headache. And patients often tell me that it's something like a throbbing quality or something as if something is beating inside the head. Regarding the intensity of the headache, patients often say that it's a moderate to severe intensity headache. Moving on, the patient is going to describe that he avoids 3 particular things. The patient would tell you that if he goes out into the sunlight or in a room full of bright light, the intensity of the headache would increase, so he avoids going into strong lights. The second thing that he avoids would be loud noises, which would also increase the intensity of headache. Then the third thing is any kind of movement or activity would also increase the intensity of headache. And these patients, they characteristically describe that when they get a migraine headache, the patient would tell you that they tend to lie down in a calm and dark room, which would give them some relief from the headache. Now, in the migraine headache, the patient also feels a strong nausea or a vomiting feeling. And few of the patients also tell us that if they get an episode of vomiting, the intensity of the headache goes down and they feel a bit of relief. Once these criteria are fulfilled, the diagnosis of migraine headache can be made with a reasonable amount of surety. But we also need to rule out other causes of headaches which may mimic some of the symptoms and signs of headache. So some of the conditions like tension headache, a sinus headache, headache because of refractory error, they may also present with signs and symptoms that may look like a migraine. So we need to do a detailed history, a detailed physical examination, and if need be, some imaging studies like a CT scan may also be done to make sure of the diagnosis. So I hope you found this video helpful, and if you have any doubts or queries or questions, you may message me or you can drop me a WhatsApp message. And please do like and subscribe to get more of informative content in the future videos that I'm going to post. Thank you.